Hello, my name is Nicole Magruder, and I am the Executive Director for Community Hero Action Group. And we are here at the 2022 PA Black Health Matters Conference. Disrupt and Build Up is our theme this year. And happy Earth Day to everyone. We are closing out today's sessions with this last 45-minute session. It will be given to us by Michelle Kondo, PhD. She's a research social scientist from the United States Department of Agriculture. And this next forum is extremely important and a topic that is often not talked about probably enough, but it is neighborhood violence and its psychological toll. So I hope that you glean additional insight after watching today's session. It will be recorded, so you can watch this later on demand, and it will be uploaded to our YouTube channel, Disrupt and Build Up. Thanks so much, and I hope that you enjoy this upcoming session.
Hello, my name is Michelle Kondo, and I am a research social scientist with the USDA Forest Service. I am stationed in Philadelphia, and I'm here to talk with you about my research on environmental strategies for disease, violence, and injury prevention in urban areas. So as I mentioned, I am stationed in Philadelphia, and I'm part of a network of other urban field stations of the U.S. Forest Service, where scientists' work and research is focused on the importance of urban natural resources, of urban forests, urban trees, and other natural resources and environments. So outside of the Forest Service primary mission, which is to manage the national forests, we also have a responsibility to help sustain our urban forests. So transitioning to my research, many of you may have heard the saying that zip code matters more than our genetic code in terms of determining our health. And I won't deny the importance of heredity and genes, but I also bear witness to the importance of our environments, our neighborhoods, and surrounding communities in terms of either promoting good health or ill health. Right? I really like this conceptual diagram provided by Ana Diaz-Rue at Drexel University. She's the Dean of the School of Public Health. And it really explains how neighborhoods, both social and physical environments, how they contribute to our health. So she begins by saying that current or historic practices in terms of those that ended in led to residential segregation by race or ethnicity and socioeconomic position, as well as inequalities in resource distribution, led to our current state in terms of neighborhood physical environments, the way neighborhoods look, and the environmental exposures that are present there, our current food, recreational resources, the built environment, and aesthetic quality or natural spaces, which I tend to focus my research on, as well as services and housing. And we can also talk about our neighborhood social environments in terms of safety and violence, our social connections, local institutions and norms. These things all affect our health behaviors as well as our stress levels, and these things can affect chronic disease and injury. So sort of a outside of the traditional medical model about how to promote good health and public health, which tends to typically emphasize clinical interventions and or pulling aside the individuals at most risk and providing counseling and education. So, you teaching people and individuals that, you really shouldn't stop smoking, you should eat better, that perhaps in addition to these types of traditional approaches, in order to have more of a lasting and or a population impact on public health, that we need to change both socioeconomic factors and modify. We also need to change people's everyday environments, their context in which, and to promote people's ability to make healthy decisions sort of as a default, sort of naturally, without so much intention and effort. And so this is part of the strategy from which motivates the research that I am involved in. And I focus a lot of my research on violence and violence prevention because so much of the public, which I serve in Philadelphia and many other post-industrial cities, the number one health concern for communities is violence, right? And gun violence, to be specific. I conducted a review of studies and research about neighborhood interventions, changes to neighborhoods, and their effect on violence. Do they have an impact? And we've found a couple of handfuls of a few dozen studies, and this was published back in, I believe, 2020, so it's a couple years old now, but and there is more research, and it's growing very much so. But what we found was that the most consistent evidence about positive impact of neighborhood interventions came from housing interventions. So, for example, demolishing large public housing complexes and or installing and building scattered site housing, as well as interventions like remediation of vacant buildings and land, in terms of positive impact on neighborhood violence. And we did also see some evidence that reducing alcohol availability, as well as improving street connectivity and providing green housing environments, can also help reduce violence. But I want to give you some examples from my research. So I asked this question in many places throughout the US and internationally. Can urban place-based and nature-based interventions reduce violence and injury? And so this is an example I want to share with you about a study that my colleagues and I conducted in Philadelphia around a vacant lot mitigation program. So this was a citywide cluster randomized trial to restore vacant land. And so we worked with the Pennsylvania Horticultural Society. I'm going to show you a photo here, or PHS, and their land care program. So PHS runs this program, and it's largely funded by the city of Philadelphia to manage and maintain nearly 12,000 vacant lots throughout the city. Just to give you some context, there are, by some counts, about 40,000 vacant lots in the city. And so PHS, this number of 12,000, it involves cleaning and greening vacant spaces, and then during summer months, mowing and maintenance, picking up trash every few weeks. And so every year, this 12,000 number increases. They increase the number of lots that they manage and maintain by 200 or 300. And so here are some photos. So the intervention involves clearing and cleaning up the vacant lot, planting some grass and trees, as well as putting up a permeable picket fence. So you're not able to see an opening here in these photos, but perhaps you can see one faintly here. The picket fences are not meant to stop people from entering the lots, but rather to prevent dumping of trash and construction debris, which often happens in vacant lots. So we took nearly 600. We worked with PHS to take 600 nearly vacant lots and sort of randomly designate them as either intervention lots or control lots, lots that would remain vacant throughout the study period, which was about 38 months, and then they would be cleaned and greened after the study period. So this is a map just to show that these lots were very much randomly scattered throughout the city and at least in neighborhoods that have high rates of vacancy. They were very much balanced in terms of socio-demographic context, so that we were comparing like with like. And then we used what is called a difference in differences technique to compare crimes, which we received reports of crime and locations from the police department. We looked for change in crime at these lots before compared to after the intervention, at intervention lots compared to control lots. And we found statistically significant reductions in crime overall, and this is at the intervention lots, but especially in gun violence, so up to 29%, as well as some other types of crime, burglary and nuisance crimes, in neighborhoods below the poverty line. We also found, because we interviewed about 450 residents living near these lots, the vacant lots and the intervention lots, we found significantly reduced perceptions of crime, and so people felt more safe to go outside, as well as they reported more sort of increased use of outside and outdoor spaces for relaxing and socializing. So this could potentially be one of the mechanisms by which we saw reductions in crimes, that more people felt invited to be and comfortable spending time outdoors near their homes. We have also published a return on investment calculation based on an earlier study of vacant lot remediation in Philadelphia, actually, where we were able to separate out what is the return on investment from the reduction in crime and violence we saw, both firearm and non-firearm violence, due to the vacant lot remediations. And we know, so that based on a typical cost of about $1,600 for this intervention, and then nearly $200 per year in maintenance, we calculated $26 in net benefits to taxpayers and over $300 to society at large for every dollar invested in this program. And this is based on cost savings from prevention of costs, due to individuals, right? Hospital costs, individuals and their families, economic loss of employment, and as well as costs associated with the criminal justice system and court system. So there are many questions which were not necessarily answered completely with our study about how this happens. What is the mechanism? How is it that if you clean up vacant spaces in a city or an urban environment, that we see reductions in violence? We also, I can say, using survey data that I mentioned, we found improvements in mental health, so reductions in depression. How does this happen? And we have theories, and which we are testing, and this is really the best one that I have seen so far, the most applicable to cities like Philadelphia. And in fact, this one is based on experience in and around vacant lots, cleaning, greening, gardening, and maintenance in Baltimore. This is what is called the greening theory of change, and put together by Dr. Kristen Mari and her colleagues, and myself included, with the Project Vital at Johns Hopkins University. So she's a PI on this project. And the text is quite small, so I will just tell you a little bit about it. But so the theory of change states that there are society level factors as well as local factors. So ranging from structural oppression and racism, historic conditions, legal codes, social and cultural institutions that contribute to local factors that affect our built environments, the social context and the neighborhood context, where we have such high levels of vacancy, as well as disinvestment in neighborhoods and communities and infrastructure. Greening activities, so there are many and numerous activities that are aimed at improving the natural environments in communities and neighborhoods, and they range from urban farming to improving outdoor playgrounds, places to play, recreation, outdoor art, murals, as well as workforce development, and improvements in infrastructure and safety, so beautification, improving lighting in outdoor spaces, cleaning up trash, neighborhood mowing and other beautification, as well as improving stormwater drainage. And then, so the mechanisms of change, which I zoom in here a little bit, can come at the individual level, the family and community level, as well as the environmental level. On an individual level, these greening activities can improve one's dignity and sense of purpose, let alone our exposure to nature and ability to be outdoors and see and natural features, improving our knowledge and our skills. On a community level, it can improve our volunteerism, our trust of one another, and it can, help us engage with our neighbors and be out and using our streets and open spaces in positive ways. On an environmental level, green spaces can improve our air and water quality, and it can reduce heat islands, so reducing those summertime temperatures, which is really important. It can reduce places to hide, so if we're talking about robbery. And so these things then can lead to outcomes such as it can improve our physical activity, our ability to get outdoors and get our steps in, and ability to play for kids. It can improve our ability to focus and pay attention, so to clear our minds. It can reduce our stress and perhaps help us recover and deal with trauma, and can help us connect with our neighbors, families and neighbors. It can improve our perceived sense of safety, and then in terms of more long-term impacts, it can improve our mental and physical health. So I ask then, how can neighborhood, place, and nature-based interventions become part of healthcare investments and practice? And I'm actively working in this area and would love to hear any feedback about my research and or ideas from you. I'm very pleased to be here, and thank you for having me.